Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, good day, everybody. Welcome to another episode of Unshelling Medicine Podcast. So today I have the pleasure and gratitude to have Dr. Zand with us. So Dr. Zand is the CEO and founder of Anywhere Psychiatry, and he's an holistic psychiatrist. Those two usually do not go together. Holistic psychiatry, whenever we're talking about psychiatry, we're talking about heavy pharma treatment, the Haldol, the Ativans of the world, and, all the heavy stuff. So it is going to be a very interesting conversation because it's going to be a learning experience for me as well to get to talk to an holistic psychiatrist. We met a few weeks back. However, we didn't get into the weeds of who Dr. Zand is. So today, pull up, let's learn together. Hi, Dr. Zand, welcome.
Hi, thank you for having me.
Thank you for being here. As stated, I'm very grateful to have you. So, educate us a little bit. Why holistic psychiatry and what is that?
Yeah, I think as you alluded to, psychiatry has been a very archaic, stuck in the kind of old, heavy psychopharm type of strategies field. It's a very young field, and only about 100 years old. Whereas cardiology is 500 years old, right? We've just started to appreciate now, I think, mental health from a new perspective, where before we were very stuck in the Western medicine paradigm of what's the diagnosis, what's the illness, how do we treat it, and that's it, right? It's very algorithmic and check the boxes and move on. I think at large in Western medicine, we're seeing that's probably not even the best strategy for any condition, let alone, your heart, your kidney, or your brain, your mind, your psyche. We work in a field where you can't really objectively quantify how you're doing, right? You can't measure your depression, anxiety through any kind of really test. There's no blood test, there's no image of the brain. It's a very subjective field. So to be put into these categories and labels and diagnoses and put into a treatment paradigm, one, it just doesn't fit. It simplifies very complex conditions and it pathologizes human experiences that really, I think, has done a disservice to society. There's a reason that nobody wants to see a psychiatrist. It makes you feel like there's something wrong with you, like you're crazy. But in fact, holistic psychiatry says that everything is connected. The mind, the psyche, that part of life that we can't really measure, can't fully understand. Science has limitations. In fact, psychiatry, the etymology is healing of the soul, right? So it's a field of medicine that already we're a little bit out of the scientific paradigm. We have to appreciate what science can't quantify. But then there's also so much to the body that goes into our mental health, our cardiovascular health, our gut health, our nervous system regulation. There are so many things, the detoxification of our liver, the way things are processed. Holistic medicine is the only type of medicine I think we should all be practicing. So it only makes sense to add that same flavor to psychiatry.
Yeah, I like the flavoring of it all. Let's sprinkle a little flavor of holistic medicine. So it is very very refreshing to hear you talk about the human experience and the difficulty with quantifying certain things. Unfortunately, that has led to a lot of stereotyping and stigmatization of certain diagnoses. So I want to bring it back a little bit to culture. What aspect of culture do you think has an impact on one, seeking help, or seeking intervention, I should say, and the other, really delving into what makes a human human, because we talk about individualized plan of care is a great marketing ploy, is a great marketing language, right? But how much of that is culture, whether it's the Western culture or whether it's the, say, Asian, African, and, all over, what impact does that have on psychiatry, seeking, support and also effectively managing oneself?
Absolutely. I think culture has a huge, huge impact on our not only adoption of these kind of modalities to seek mental health treatment, to seek therapy, to understand that our mind is something that it's not weak if you want to try to strengthen, if you want to try to learn more about yourself. But also, I think it's the culture is part of the treatment. It's part of understanding the awareness of where my mind is, why it's built in certain paradigms. If, for example, I'm of a family background or culture that says, suck it up, emotions should not be expressed. Well, there's nothing innately wrong with saying that. I mean, I think you can go through life and be fine having this old school approach, but it can materialize and actually show up in the body. So if someone says, suck it up, this is how I deal with emotions, crying is weak, speaking about my vulnerabilities and my traumas is not important, that's in the past, focus on the present and future, that's all excellent. And let's explore that. There's nothing wrong with that. Let's also add to it that the things that we've maybe held in, those traumas, those repressed emotions, might actually be expressing themselves in other ways. And if we're not sleeping well, if we're feeling anxious, if we're feeling reactive, angry, if we're just feeling unmotivated, low energy, sometimes it's those unprocessed parts that, call it what you want, if we can just explore, do some talk therapy, check in with yourself, talk to a loved one, find a professional who can just build awareness. All of a sudden, what we notice is that purge of emotion, when done in the right place. Maybe it's not for social media and the whole internet to see. Maybe it's not, I need to talk to every friend about everything I'm thinking, feeling, and all the traumas I've been through. But we all do deserve someone to check in with. And that's what we do in psychiatry. We create a safe space for people to explore vulnerabilities. Now, bringing it back to culture, we have to be very present to that. If I sit with a veteran, right, and the veteran community, we're not really opening up about our feelings. That can actually be a deterrent in our mission, right? In active military, we are taught to use our emotions and funnel it towards aggression and take it out on the battlefield. So if I go to a veteran who's been through that kind of programming and that's his culture, and I start to have heart-centered conversations about self-love and really emotional awareness, he's going to say, this isn't for me. So we have to be culturally aware. And instead of talking about maybe breath work with a veteran, I talk about tactical breathing. If we're, speaking to different cultures, we have to be aware of that and help people not only move past any limitations, but take advantage of what that culture uniquely brings to them. And so I think it's a big part of the way we show up in care is being present to culture, not shaming it or making it wrong, embracing the strengths, and just mitigating for anything that maybe was repressed during that time.
That's so beautiful. Thank you. And I like how you brought in the military because, um, in speaking about culture, I focused on origin and environmental, but, occupational culture does exist, right? A culture within healthcare system, a culture within the military, like you so eloquently put it, or the construction workers, or the guys that are farming and doing the hard work, right? So there's a certain culture that is also attached to occupation, and thank you for speaking about that. So for our listening audience who may find it difficult to connect what you said about a psychiatric or brain need manifesting physiologically, in a symptom, right? It's like, what does my brain and my mind have to do with my body? So how is that even possible? So can you kind of like delve into a little bit of that for us?
Yeah, this is a very fascinating part of our industry in psychiatry, what we call psychosomatic illnesses, that every single doctor that they've been to says there's physically nothing wrong with you. We don't understand why you have this symptom. That's a physical symptom. It must be manifesting psychologically. And traditionally over the last 10, 20 years, when I started my career, it almost just felt like medicine was giving up on somebody, and it's just like something wrong with your head, and that's so challenging to someone's self-esteem, self-confidence, that like I'm physically going through this, but they're saying there's nothing wrong with me. And so I'm suggesting that there actually is more physical than the doctors might be overlooking. The brain is attached to the nervous system, right? You have the whole spine and all of your nerves through the whole body. And so if there's a part of the brain that's saying, I'll give an example. I was at the hospital rotation young in my career, and there was a young 19-year-old Caucasian male who came in, and went to the emergency room, said, "I can't use my legs." And every doctor did every test. They tested his muscle strength, they tested his nerves, they tested everything, and they just found nothing wrong with his legs. He had no injury, he had no reason why this would be happening. They did infectious disease tests, right? They tested everything. And so finally they said, "Psychiatry, you guys figure it out." And so I sat and I talked to him because it's, at this point, not my role to touch his leg or take a test. They've done all that. And I just said, "What's been going on in your life? What brings you to, well, I was in Las Vegas at the time. What brings you to Las Vegas? Where are you from?" And he said he was from Utah and he was in Vegas on a mission trip for his religion. And I said, "Oh, tell me more about that. How's that going for you?" He said, I don't really agree with what we're doing, and I feel kind of conflicted about it." And then he went on to tell me that for the last couple of weeks, his legs wouldn't work. And this is an extreme example of someone having an inner resistance, conflict with the ego. Right? There's a lack of harmony between the spirit, the belief of life, and our actions. And the brain literally transmitted to the legs and said, "We're just not going to move anymore until you feel at peace." And this limitation, I don't think he was lying. These are tests that they do where you can tell if somebody really is feigning these symptoms, because you ask them to hop, you poke something, and literally he just wasn't having movement in his legs. And so you start to realize the illness is in repressed feelings about life, about spirituality, and conflict with family, conflict with community, conflict with self. And this manifests in an extreme case into a psychosomatic paralysis. But in very similar cases, this could manifest into high blood pressure, right? We're all of a sudden feeling stress, cortisol goes up. It can manifest into anxiety. We're just anxious every day. We're doing something that is not in harmony with what we think is okay or what we want to be doing. It can manifest in sleep issues. And so it is all connected. And these are examples where the average doctor would just probably say the kid's making it up, or it's just something science can't explain. But I want to bridge that understanding for people and say science is explaining this. There's a program in the brain that's faulty, and it's transmitting through the nervous system in a way that's shutting down. And once we can open that up, we did some therapy with him. He had to end up talking to his family. That was the big hurdle. He didn't want to admit, because he knows that if he says, "I don't agree with this," he becomes outcasted from his community. That's such a heavy consequence, to be honest with oneself and to be honest with one's family. And so it wasn't easy, but overcoming that, he started to realize that, yeah, maybe this isn't a physical thing, and it's in my heart, it's in my soul, it's in my mind. It's not in something we can image or take a blood test of.
That's the realist story. Thank you for sharing that. And I think that story I really relates in a lot of parts, because sometimes we downplay the I'm looking for a nice word. Um, sometimes we downplay the impact of the mind's conflict on the body, or the soul's conflict on the body. And I know a lot of us in society go along to get along, because we don't want that, conflict with family, conflict with friends, conflicts in a place of work or associates. Uh, how damaging is that?
Yeah, it's, there's a lot of work on this. Dr. Joe Dispenza talks about the energy that we repress, manifests in other ways. Emotional release therapy is just a therapy where if you are exposed to it for the first time, you might think it's crazy, right? These quacks, what are they doing? They're asking people to scream into pillows, to shake their body, to release energy that's been held. I've seen uh, expressions of healthy anger help people overcome years of anxiety, depression, insomnia, or even physical illness. And so when we repress something, it not only affects our subconscious mind, because the conscious mind is saying, oh, I'm focused on my work, I'm focusing on making this person happy, I don't want to create a conflict, I don't want to get in trouble. But the subconscious mind is saying you're being dishonest to yourself, to the world, you're hiding something. And then all of a sudden, the program starts to unravel. When we're sleeping, we get nightmares. When we're not really paying attention, we feel anxious because it's tugging at us that you're in a situation that is not serving you, that does not give you peace. And so I think that, the key to all of this isn't only the expression of the emotion, but it's also another factor, because again, this is holistic. If this whole conversation was about the emotional state, then this would be a psychology conversation. But there is more. There's the nervous system that we need to regulate. There's actually the brain that we need to reset. When we're running a pattern, all of a sudden that pattern just likes to repeat. The brain likes to repeat what it's done in the last 5 days. If you've ever went to the gym for 5 days in a row, that 6th day is pretty easy. If you didn't go to the gym for 5 days in a row, trying to go to the gym on that 6th day is impossible. It's just, the brain's not used to it anymore. And so neuroplasticity is the one neurological term that I try to explain to everybody, my patients, our providers that we train, to really understand how we can help people the most. We all need a neuroplastic reset. Neuroplasticity says that the brain continues to change. It creates new neurons, it creates new neural patterns, it creates new connections. And if we don't foster and nourish neuroplasticity, then it becomes rigid. These patterns that don't serve us, they just keep running in the background. My spouse doesn't really love me. My boss is going to fire me. I'm never going to make it. These thoughts, they might not be on our mind all day, but they're running on a loop in the background. And so we need to hit Alt Control Delete on the brain. We need to be able to disrupt these patterns, create new neurons, fertilize the brain to nourish new pathways, so that a good therapist helps us change the way we think. But it's an uphill battle if our brain is stuck in a neuro-rigid pattern. So there are many ways to enhance neuroplasticity, and that's really bringing it holistically together. We have to work on brain health. We have to work on psychological perception. And then we might have to actually go into those relationships and situations and build boundaries, have the difficult conversations, speak our voice so that it's not repressed.
Beautiful. So, as you were talking, the one thing that came to mind is family dynamic, and some of this negative background noise in the subconscious are usually tied to traumatic events. So, and most people do not want to visit that traumatic event, um, and rightfully so. Who wants to do something that is hurtful? However, that for me, I feel like is a deception to yourself, and fallacy of sort is like, oh well, I went through this, well I came out fine, I'm doing just fine, kind of a conversation. How important is it for um, people to address or at least be honest with themselves about their past experiences, however traumatic? Uh, a lot of people don't believe that, you have to basically revisit it to get over it. You can just open a new tab and get over it and, deal with it that way. Regardless of the approach, how important is it for a person to recognize that, hey, this may not be in my forefront or in my conscious mind. However, there are aspects of this events that do affect my decision making, do affect the situations that I find myself, whether it's like an abusive cycle, right? Or a cycle of just self sabotage of sort.
Yeah. Trauma can be really scary to revisit. We've spent our entire life building defense mechanisms to not deal with the effects of the trauma. And now you're telling me you want me to go back and thinking about it again? Like that doesn't feel good. And in fact, trauma counseling, right, when we're doing trauma therapy,
Yeah,
if it's not done properly, or if it's explored perhaps with just a friend or a loved one who maybe isn't professionally trained to
yeah,
understand how to help that person, or if we're just journaling about our trauma with no guidance or direction, this can actually be very damaging. And so I want people to be careful when we're exploring trauma. We have to feel safe. That's step number one. Because if we just go through the same loop, the thing that's made us feel fear, the abuse, the neglect, whatever it was, and then we just bring it up on our mind again, what will happen is everything that previously has come up: anger, sadness, fear, guilt, shame, all of these emotions then come up. And what do we do with them? We need to be able to process them. We need to be able to regulate our nervous system so that when the thoughts come up, our heart isn't pounding, our nerves aren't on edge, we're not sweating, shaking. I can remember early in my career when I'm doing trauma counseling, I can smell the stress on people, and they weren't feeling safe. It was a stressful experience. I'm just in this office. I just met this person and I'm speaking about my most vulnerable, difficult things, even as safe as I try to help them feel. Literally, I could smell the stress on them. Now, a better psychiatrist or therapist, more advanced in my career, I won't even open that chapter until I know that their nervous system is at ease, that they feel safe with me, that they feel safe with themselves, that they know that we practice some relaxation techniques, that they know that there's a direction we're going. We're not just opening up this can of worms and then saying, okay, now deal with it. I'll see you in a month. We're actually bridging towards courage. We're bridging towards peace. We're bridging towards acceptance. We're bridging towards resilience. Whatever it is that we're looking for, we're not just wandering this path alone in the dark. And so I think that's what's really important, is that, yes, we do need to explore our traumas, because if we don't, they control us, right? The subconscious mind, the things that go in the background, when they're not tended to, when they're not addressed or processed, we live our whole life at their mercy, because they're telling us, don't go out and expose yourself. Don't give yourself that chance because you might fail, right? It's reminding us of the protection that it gave us perhaps when we were young. And so we have to feel safe before we get into this. And that's why I think trauma counseling is so scary, because who are you supposed to talk to? If you're a child, maybe your parents didn't make you feel safe about opening up. Maybe they made you feel that it worried them every time because they care about you so much, right? It's not a lack of love, but their expression, the way that they received you coming to them and saying this bad thing happened, is anger towards the person who did it, or worry for your future, rather than just holding safety, explaining things, explaining that life has ups and downs and we're so sorry you felt this. Can we just hold you and regulate your nervous system? Because at a young age, that's more important. They always say it's how you respond to the trauma, not the trauma that happens to you. So if we have that love and nourishment and encouragement, which usually at the ages we go through trauma, we didn't learn it for ourselves, let alone as adults, we haven't learned these things. And so what if we didn't have that parent that was educated to hold safety? What if their parents didn't help them in that way? This is where a good therapist or a good psychiatrist, really, this is our profession. This is what we do. And so that's the encouragement that we should push through and find the courage, but also we should be very cautious that we feel safe with the right person.
yeah. You touched on something very sensitive for me, which is parenting. And I find a lot of people in a space of doing better. And I think that is a constant thing with human in general. We want to show up for children in a way that we may not have experienced it, especially with investing in ourselves and well-being, mental health, wellness, whatever you want to call it. And sometimes it's difficult to know the right thing to do, especially if you want to show up a different way than you were shown up for. So, as parents, you touched on safety. It is important to, build that foundation of safety as opposed to being reactionary. parents want to protect their children. They want to go to war for their children, and that is like the first instinct or the knee-jerk reaction, which is not always the best. So, just touching a little more on that for me, please, for the parents listening and who want to break whatever cycle it is. What is the primary thing or the paramount thing that they should worry about, or they should focus on, I should say, when it comes to creating a safe space for their children, whether it's holding that space and regulating them, their nervous system, or teaching them how to self-regulate in their absence.
Yeah. So important because, like you said, most parents, I mean, if not all parents, they want what's best for their kids, right? They try to do what's right. And it's not that they're bad parents when they maybe show up in a way that their child doesn't feel safe. That's just their nervous system going off and saying, I can't believe this happened to my child. I feel terrible. And my goal is to always protect them. Did I let them down? Their shame and guilt comes up. Their protective defense mechanisms come up. So I think step one, always, and this is the hack of parenting, is if you want to be a good parent, you have to reparent yourself first. And finding that ability to work through some of the alarm response, right? The nervous system response, regulate that, and then be there for the child. I can make it very easy. We have an acronym that we use for our therapists or psychiatric providers, how to hold space for people when they're going through difficult topics, traumas and such. And the acronym is just LOVE, L-O-V-E. The L stands for listen. And we have to listen empathetically. This is where just being present, just holding space and just saying, I'm here and I'm listening, share what's on your mind because it's safe to share that. That's so important, paramount. As parents, we often accidentally make our children feel like it's not safe to say what's on their mind. And so we have to remind them that anything you tell me is okay. I'm here for you. Listening empathetically is also active listening, showing them that we're engaged, right? We're not in the middle of checking all our work emails. We're sitting down, we're holding that space. The O is for observe, especially with children. Children don't always say what they're feeling. They're not equipped. They haven't learned the language to explain their emotions. They're just upset, especially younger children. Right? Temper tantrums. I don't have my toy, and I'm just going to scream and say, I hate you, right? All the way to a deep trauma. Someone did something to me at school, and I don't know if I should say it because I don't know if it's okay. It makes me feel icky. And so we have to observe what's not being said, observe body language, and also observe ourselves. How are we reacting? That goes back to the first thing I mentioned is, are we feeling safe in the moment? Because we're modeling that safety to our children. The V is for validate. This is so important because often we want to protect, we want to explain, we want to guide, we want to fix the situation, right? This happened to you. Well, if a bully at school was talking to you that way, well, this is what you should do. Hold on. Before we get there, can we at least just validate that this was a tough day or a tough year, a tough semester for your child, and let them understand that you hear them, that what they're feeling is valid, that it doesn't feel good to have somebody verbally abuse you, make fun of you, do whatever it is, or if not, sadly, even worse, and that I am telling you it's okay to feel the way you're feeling. If we repress those feelings, if we tell them it's not okay to feel that by just jumping to the fix, then the child says, okay, I'm not supposed to feel this. I'm not supposed to feel sad. I'm not supposed to feel angry. I'm not supposed to feel fearful. I'm just supposed to go and fix this right away. And so validating the emotion is key. And then the E is for explore. At this point, we're just helping our children learn about life. If we try to fix everything, then we're not giving them the tools to understand how to be there for themselves. And so the exploration is just asking questions. How did you feel when that happened? What did you do afterwards? What were you feeling physically? Kids often show up when they have trauma with GI issues. They get so nervous, they throw up, they have stomach pains, diarrhea, constipation, things of that nature. And so asking them the questions so they understand that what happens externally, how the mind processes it, actually affects the body as well. How can we be there for ourselves? This is where you talked about coping skills, regulation. How can we communicate these things, right? Helping our children be able to verbalize, maybe with the person who's doing the thing, maybe with the teacher, maybe just with the parent, encouraging them that bringing this up was so important. And let's explore. Is there anything else that you want to share with me? So just think about it that way. If you're a parent, it's all we want to do is love our children. So we listen empathetically, we observe what they're not saying and what we're feeling, we validate their emotions, and we explore how to handle this in life and what else is contributing, and how we can help them create the tools for themselves.
Oh my goodness, thank you for that, Dr. Zen. I have learned that, and I'm parenting a teenager right now, and life is life for both of us, and we're both learning, and I'm showing up in ways that um, works for her. Forget me. How do I show up for her? How do I show up in a way that she would want me to show up, because she's her own person, she's her own personality, and it's, we're similar but very different. So thank you for that, and that really did help. I absolutely love the part that you touched on the GI manifestation. The gut is usually considered the second brain, and even in an embryo formation, the brain and the gut are kind of like together, and they pull apart. So again, linking things. So what does my stomach have to do with my brain? So
Yeah.
we have that big old vagus nerve that goes all the way through, and it is originating from the brain. Please, could you draw the correlation for our listeners so they can be better equipped and better understand that everything is really connected?
Yeah, yeah, the gut is fascinating. It's so many things. You mentioned the vagus nerve. There is a nerve that goes through our whole body. Growing up in Vegas, studying in Vegas, teaching in Vegas, I always used to say, "Heal Vegas, heal the world." And now I spell that VAGUS for the vagus nerve, because really that's what we need to do is regulate our nervous system through vagus nerve stimulation. But it's beyond that singular nerve that's so important. There's a whole network of nerves, right? The nervous system attached to the brain reacts, and our nervous system really has multiple modes. One is rest and digest. And so when our nervous system is relaxed, we can digest properly. And the inverse happens when we put bad food in our gut, our nervous system reacts to it. And so it goes both ways. And beyond that, there's serotonin receptors. We all kind of think of serotonin as the happy chemical, the mood chemical, the neurochemical that helps us feel relaxed, helps us feel upbeat. And in fact, there's more serotonin receptors in the gut than there are in the brain. This is why people who have been on antidepressants, which try to increase serotonin, often get GI side effects: diarrhea, constipation, nausea, things of that nature. And so the other thing is nutrients that go to the brain. Most of them are coming through the gut first, right? They're being eaten, digested, absorbed, and then distributed through the bloodstream. Now, if we have leaky gut, if we eat improper foods, if we inflame the gut, then we're not getting nourishment to the brain. And so it is a mutually synergistic relationship. If the brain can be relaxed and the body can be relaxed, then the gut can absorb better. If we put good food in the gut, then all of a sudden the brain is more nourished. Some of the biggest issues that we see in mental health start with our nutrition, start with the poisons and toxins we're putting in our body that then travel up to the brain. So really, really important. And the manifestations are inverse as well. So if you have a healthy gut, you generally have a healthy brain, and the inverse. And if you want to improve one or the other, then they're both going to get better.
Beautiful. Thank you for that. It all starts in the gut, people. Whatever you put in your body, it's just that adage: what you are what you eat.
Right.
You really are what you eat. You affect your brain depending on what you eat. And unfortunately, we have food deserts that people do not really have access to quality food. And there's this manifestation of mental health disorders, disturbance, however you want to term it. So thank you for that explanation. So let's go to social media. As we're getting into towards the end of our conversation. You mentioned it initially about the importance of having a trusted um, mental health professional, whether it's a psychiatrist, a psychologist, or a therapist, to really vent or communicate your feelings to. Um, Maybe it's not for social media. So what are the detriments, the benefits and detriments of using social media? There's this saying that social media doesn't forget, and some people have used social media as a personal diary. I think that is because of community. They feel like they have a community online that they may not have in their personal lives. So please, what are the detriments of you know venting to your online community as opposed to um, a trained professional?
Yeah, yeah. I think we're all seeking validation, and if you
Yeah,
extend social media to AI, validation is there to be had, right? And if you're going through something, the community generally shows up. There's someone who's saying, "I'm also going through it."
right.
So, in some ways, it's a reminder that we're all connected. It's a reminder we're not going through things alone. However, there's two things if we just keep kind of speaking our mental health and traumas onto social media. Two things happen. One, it becomes our identity. And this is the opposite of what we're really trying to do in holistic psychiatry, to say that you are not a disease. You're not depressed. You're not bipolar. You're not anxious. It's an experience you're having. And if we over focus on these things, all of a sudden it becomes our identity. And then it becomes harder to separate from it, right? Oh, I'm working on my anxiety. I'm working on my depression. Well, the fact remains that you're depressed if you're working on it, right? If you're working on it. And so, can we shift away from that? And what ends up then happening is you get the extreme response, which is, look at me, life is great, right? And now we just create a facade of, I'm doing the work, I'm healing, life is good, abundance. And really, there's the balance in the middle that's the key to life, because desire and pride, if we focus on that, if we focus on comparison and social validation, it leads, it's a very energy draining experience. It leads to anger if we don't have it. It leads to fear if we don't think we can get it. And so instead, if we are just authentic, communicating what's really going on rather than what we seek or what we're moving away from, it gives us a sense of neutrality, a sense of acceptance, a sense of connection. I think social media has a lot of detriment, and beyond just what content we're putting out, the more important one is, what content are we ingesting? Mental nutrition. We talked a lot about the gut and the nutrition that we eat. What's the mental nutrition that we absorb through our optic nerve, through our ears, right? It all goes to the brain somehow. And study after study is showing that these addictive patterns on social media are leading to dopamine desensitization, which means we don't even want to have any sense of desire, reward, or motivation anymore. You just doom scroll and it become passive. And these quick videos give this quick dopamine hit, and then delayed gratification becomes difficult. To work hard for an outcome, I want it now, right? 5 second video. Like, I don't even have the attention span for a 1 minute video. And this is where we get issues with focus, issues with sleep, issues with anxiety, people who can't stay on conversation, they're constantly distracted. It's because the mental nutrition is programming their brain in 5 second bites. And so there's so much detriment. I think the inverse of that is create healthy mental nutrition, right? Let's not be toxic positivity and like everything is rainbows and butterflies. You can't turn off the world. But if you're going to stream what your mind is ingesting, same way we try to create a good diet that's healthy and nourishing for us, let's do the same. Let's find things that are uplifting. Let's find community. Let's find the good news, not just the bad news, right? And provide balance. But really, more than anything, I think it's just healthy breaks. If we overconsume anything, that becomes the poison. The dosage is the poison, right? And so just little amounts of it, you'll be fine. But if we're on it for hours and hours every day, then it becomes toxic.
Yeah. Have you found that, you kind of like you mentioned it a little bit, that the ability to converse is impeded by, the those quick dopamine hits that we have from doom scrolling? Uh, not being able to sustain a productive conversation of sort because it's just tasking at this point as opposed to what scrolling would do for you.
We've truly become time travelers. It's hard to stay present in our mind, right? When we're with somebody, we should be with somebody. We should be listening. We should be engaging. What ends up happening is our mind is in the past or the future. What am I going to say next? What happened in the past? And this is where social media drains our ability to be present because we're just passive, right? We're not in our, what we would say in neurology, prefrontal cortex, that computer processing part of the brain that keeps us mindful, keeps us aware, keeps us observant. Rather, where we become reactive, we become passive, we become distracted. And so social media is really draining our ability to just sit still and be with ourselves, be with nature, be with our loved ones.
Thank you for that. So let's talk about holistic psychiatry. So somebody listening to us that has been, because we have to be honest with ourselves, that it has a lifetime of pharmaceutical intervention for whatever diagnosis that they received at any point in their lives, and they're looking to holistically work to address their presentation symptoms, whatever you want to call it. How can they work with you? How is that process, Dr. Zan?
Yeah.
So they already have an established treatment and they're looking for something else to complement that.
Yeah. Yeah, we see people who have been in psychiatric care, who are new
Okay.
to it, who want to be on medication, who don't want to be on medication.
Yeah.
We'll meet everybody where they are and just give the proper education and guidance there professionally, as
Okay.
well as exploring everything else therapeutically, socially, how are our relationships, spiritually, how's our relationship with the unknown, with death, with purpose, with calling in a life. Are we tending to that as well? So our clinic, anywhereclinic.com, you can hop on. We're in over 30 states. We're striving to be in all 50, and we're striving to accept insurance in every state. So Medicaid, Medicare, private payers. And if someone doesn't have health insurance, we try to have a low discount self-pay option as well. I would say if you're already seeing somebody, it's okay, treat this like a second opinion. Are things going right? Do you think this is a good plan? If you want to seek someone who, my favorite thing is I've had multiple people tell me, I hope I can be with you until the end. And it's just that journey we get to walk together. That's really what being a clinician, being a doctor means to me is, I'm consistently there for somebody. And so I think it's nice to be able to have that, especially for most of us who just in life, we don't tend to have that kind of safe outlet. Our friends are busy, our family is busy, we don't want to burden them. And so, yeah, anywhereclinic.com, you can check your state if it's available, find your insurance if it's available, and then connect with a provider who hopefully becomes a partner in your journey of life.
Beautiful. And you on any of the socials at all?
Yep, it's at Dr. Sam Zand, DrSamZand. Find me on any of the socials. If you're into learning more about your health and wellness from both a scientific and a metaphysical perspective, what science fully doesn't comprehend, that we're learning more and more about now, we're trying to fuse all that together so that we can be evidence based, knowledge informed, but also open to the exploration of the unknowns of life.
Beautiful. I love the fusion because there's so much we don't understand about the human experience, being, mind, functionality, but we also know enough to have managed and emphasis on the manage yourself still now, and there's so much to explore and to know. So I thank you so much, and I'm very grateful for you being here, Dr. Zan. So usually I ask, I know you left a lot of things, but I need more. I usually ask my guests to please leave us with a golden nugget or a few golden nuggets. What would you like our listeners to walk away from this conversation with?
Yeah. I think it's just one thing. We've been talking a lot about what psychiatry and mental health isn't, right? We don't need to label and diagnose a disorder. Let's talk about what it is. It's finding what's truly unique and beautiful about you. It's understanding your strengths and honing them and sharpening them. It's understanding maybe our weaknesses and not shaming them, judging them, but trying to either improve them, delegate them, or eliminate them. It's understanding ourselves in totality, why we are the way we are, and figuring out who we really want to be every step of the way. That's really what psychiatric work is. That's what mental health work is. It's finding the best version of you. And so let's do away with the past of stigmas and diagnoses and illnesses. Let's really just focus on what makes us all uniquely beautiful.
Thank you. I love that. Thank you. And ladies and gentlemen, boys and girls, that's what psychiatry is. So let's learn and, unlearn and, live our lives the way it was meant to be, fulfilled and full of joy. And you don't have to fake it. You're not impressing anybody, impress yourself. So that's that. So thank you, Dr. Zand. Thank you, everybody, for listening. And please, please, please let us know what you think. And when you watch this episode, if anything resonates with you, please let us know. I'm hoping to have more of this conversation with Dr. Zand. He doesn't know that yet. But I'm
Happy
hoping
to.
I'm hoping to have this conversation, more of this conversation with him, because it's really, really incredible what he's working on and what he has done. So, and many more like him. So let's build out this community and help people understand and live out this human experience. So thank you, everybody. Take care of yourselves. Bye bye.
Thank you. Thank you.
Thank you.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.